can go ahead and get started. Good morning and welcome to our Childhood Trauma Learning Collaborative Community of Practice for our online Healthy Knowledge course, Cultivating Compassionate School Communities that Respond to Trauma Effectively, with myself, Dana Asby. I'm the Education Coordinator for the New England MHTTC, and Dr. Martha Staley, who's the Director of the School Mental Health Initiative for the New England MHTTC. I'd like to acknowledge the traditional ancestral unceded territory of the Wappinger Nation, now known as the Greater New Haven, Connecticut area, where Martha and I are joining from. Our funding does come from the Substance Abuse and Mental Health Services Administration. The views and opinions expressed in today's session are those of the presenters and not of SAMHSA. The Mental Health Technology Transfer Center Network uses person-centered, affirming, respectful, and recovery-oriented language in all activities. And during this session, please ensure that whenever you're contributing to our discussion via the chat, or when we have time for a discussion, that you also use language that is strengths-based, healing, and trauma responsive. We will be allowing you to unmute your microphones to engage in discussion with us and ask that you mute any background noise if possible. We're pleased to offer the option of closed captioning. You can select this option and change your transcription setting by clicking that CC Live transcription button at the bottom of your Zoom screen. And your registration today affirms your consent to receive an evaluation follow-up link via email and your consent to recording. But if you experience any technical issues during today's session, please send a private chat message to Ingrid Paget, our technical support manager for today's webinar. Now I'd like to pass it over to Dr. Martha Staley to lead us on our agenda.
Hi, good morning. We are a small group today, which that's terrific. It's more intimate and may give us some more time for conversation, but we also might get through our agenda a little bit faster, in which case we can give you some time back. So we're going to start with a brief mindfulness moment with Dana. We're going to do some quick introductions, do a very quick review of what this course is, talk about our schedule together, and our developing and emerging implementation guidance that we hope you'll help us with, our goals for this community of practice, and then some discussion and question and answers. So I am first going to pass it to Dana for just a brief moment to center ourselves.
Thank you, Martha. So we're going to open each session with a mindfulness moment because part of our beliefs is that practicing mindfulness together creates a sense of community. So because Thanksgiving is around the corner, I'd love to start out with a gratitude practice. Research shows that the simple thing of expressing 3 things that we are grateful for can help reduce anxiety and depression. So I would love for all of us to just take a moment right now and think about 3 things in our life, past, present, or in the coming holiday season that we are grateful for. And we can all go around and say those things out loud, or if you'd prefer to put those in the chat, you can. So I'll start out. I am grateful for the sunny days that we have been having, even though they're short. I am also grateful for my dog's comfort, constant comfort that she gives. And I'm grateful to be able to share some of these really important trauma responsive practices with schools in New England and beyond. Martha, do you want to share some things you're grateful for?
Sure. I do this every morning, so I'm ready to go. I'm grateful for how beautiful New England is in the fall and all of the colors that I can see in my backyard. I'm grateful that I am going to be able to see my family across the country for Christmas and the holiday season, and I'm really grateful for the work that I get to be able to do. Does anybody else want to share anything that they're grateful for? You can write it in the chat if you're more comfortable, but no pressure.
Well, I could say that I'm grateful for parents and the upbringing that I had, the advantages that I had that others don't. Grateful for support in the community and grateful for the challenges that very much exist in the community to work with. with the support of others.
Thank you very much. Anybody else?
I'd like
Daryl?
to say hello.
Hi,
I'm
good
Earl
morning.
Miller. Good to see everyone. I'm grateful for my faith tradition. I'm also grateful for my family and friends, and also grateful for the opportunity I have to work with families. I'm a school social worker, and I enjoy working with families and empowering them to live the lives that they want to and deserve to live. Thanks.
Thank you.
I am grateful for my colleagues. I'm grateful for my family and friends, and particularly my husband's health. And I'm actually really grateful for the holiday season that's upcoming. I'm looking forward to seeing people that I haven't in a really long time and to decorating and all of those fun things.
Thank you all so much for sharing what you're grateful for. It makes us happy to hear what others are grateful for as well. Thank you for helping us start this out with a really positive note. Now we are curious if you have taken any part of our course. Really brief poll here. If you finished the course, you're about halfway through, you've just started, you've kind of looked at the course materials but haven't started yet, or you don't really know anything about the course. And we are happy to have you no matter how much engagement that you've had. Great, so one started and one who has reviewed the course materials. Great. So let's start our community of practice out together with introductions, and we'll go around and tell our name, our school or organization, and its location, as well as your role in youth mental health or mental youth service, and then how you plan to use this course. It was designed as a self-directed course for individuals, but we can also use this in a small group or with our entire staff. So my name is Dana Asby. I am the education coordinator for New England Mental Health Technology Transfer Center. I'm based in New Haven, Connecticut, and I hope to guide schools, districts, and states in using this course. Martha, would you like to go next?
Sure, I'm Martha Staley. I'm the director of the C-TLC and the lead for the School Mental Health Initiative for the New England MHTTC. And I'm also on the faculty at Yale School of Medicine in the Department of Psychiatry. I'm excited to have people using this course that we took a lot of time, took a lot of work and a lot of input from people around New England to help us develop it. So I'm just looking forward to see how it's used and if you find it useful. Ingrid, do you want to go next?
Sure, I'm Ingrid Paget, and I'm a communications and program strategist with the New England MHTTC. And my role is to help make the course as accessible and user-friendly as I can to support implementation, which I'm happy to do. Excited about.
Beryl or David, do you want to introduce yourself?
Okay, I'll go. Dave Cody, I'm really not formally connected with the school. I'm working with pretty much a volunteer agency in extreme northern Maine, Van Buren. Our eastern border is Canada, and we're about 50 miles from the northern border with Canada. I do provide pro bono social work services as a retired LCSW over there at the school. What we're doing now with us, our small group, which has a very unwieldy name, the Rural Resiliency Community Alliance, is we're developing an after-school program, which is something that does not exist in this small community of about 2,000 people. We want to start small, and this, to me, is the whole concept of a community school is something that we definitely do not have in this town, and something that I think we can begin to make some inroads with a decent after-school program. I plan to use the course. We've got a retired teacher who's going to be working with us, and we've got our funding going. We should get the program off the ground very slowly and very cautiously in the December Christmas break and then pull it in as an after-school program in January. We'll use the program hopefully to work both with people who are staffing with us, mostly AmeriCorps and Vista volunteers. And it's not a big group of people, about 4 people altogether. And then begin to use it in community forums and working with the administration and the teachers at the local school system. So that's where we're coming from, I think. I'm an old guy with some new challenges, and it's kind of fun. And really appreciate your assistance.
And thank you. I'm sorry, I pressed the button and couldn't see you guys, so I'm not sure what happened. But look, I am a school social worker in Gaston County, North Carolina, right outside of Charlotte, North Carolina. And school social worker, I mainly work with children with attendance issues and those types of things. But one, I love learning and I'm a lifelong learner, and I really want to be the type person. I'm still a change agent. That's how I see myself. I'm LCSW as well, David. Woohoo. But see myself as a change agent. And so really wanting to learn myself, but also work with the other school social workers, do some training and development with them. I work in 2 very high needs schools. And so want to hopefully use this information also in professional development, with professional development opportunities with the schools I work specifically with. And then also at the very least, we have an annual learning academy, and would love to be able to share some of this information countywide. So that's just a little bit about what I've been thinking. I checked, I looked at the material and hadn't started, but I didn't see a place where I haven't started yet, period. So I haven't done anything, but I'm waiting, look, for some of those optional teacher work days where I can kind of pour myself in a little bit more. But I'm very excited and just want to express my appreciation for this learning opportunity.
Dana, you're on mute.
Sorry about that. Thank you, Beryl, for sharing that. We're looking forward to working with you as well. And we have one more with us, Amneris. Did you want to introduce yourselves?
Sure. Good morning, everyone. I'm currently driving, so I don't want to, for safety, show my face or be on video, but my name is Amneris. I am a licensed independent clinical social worker in Boston, Massachusetts, and I am a staff senior clinician at a counseling center at a university. I'm new to this role, so I'm just trying to learn as much as I can about how I am, how can I support the undergraduate and graduate students with, everything on top of COVID that they're struggling with. My first time working in higher ed, so I know that there's specific challenges, and I've worked in just one school setting before, but I was more a consultant, and now I'm integrated into the school. So as a member of the school community, I just want to learn about what I can do and how I can support. So I'm really happy to be here today. Thank you.
Great. Thank you all so much for giving us that context. It's really helpful. I'm going to pass it back to Martha for an overview of the course.
Yeah, I just want to say how delighted I am that you 3 are here with us today. We're hoping that other people will take a look at the recording of this, but what an interesting and varied group of people doing this kind of work, and really the kind of audience that we were hoping to engage with this. We know that you all are out in the field doing this on the ground, and this course is designed to give you some support and hopefully some connection and sense of community. So we're really glad that you're here. If you don't know much about our course, obviously the course is free. It takes about 12 hours to do. It's online. It's for, as Dana said, it's independent learning, but we designed it so that you could do it yourself individually or with a group or throughout the school. There are 12 hours of CEUs available for this. And we have an action plan to guide the implementation of our recommendations, and we're working on putting together an implementation guide, hopefully with some of your support and feedback. So in terms of the topics that we'll be covering in Cultivating Compassionate School Communities, if you're not too familiar with the course yet, we'll be This is our introductory session. It then goes into the neurobiology of trauma and stress, mindfulness, mindful leadership, our school mental health model and heart-centered learning framework, compassionate school responses to tragedies and crises, trauma-informed screening, collaboration, including student and family voice, cultural humility and courageous conversations within compassionate communities, and creating a vision for your school community, as well as a review of the key learnings. So that's a very brief overview of the topics that we will be talking about throughout this course. There's a lot of great material and a lot that's linked within the course for extended learning opportunities. Our goal is to create a compassionate school community so that to help you all within your communities develop broad foundational learnings of these types of topics throughout your district or your school or your organization, particularly around the neurobiology of trauma and stress, which we know is just even more important now than it ever has been, to help you develop and understand the benefits of using mindful approaches to transformational leadership, being change agents, how to do that mindfully, considering how you are using your collaborations and creating a comprehensive school mental health support system, and to create visions together so that you and your groups and organizations can work together to create goals and a vision of what you want your school community to look like. So that's a very brief overview. I'm going to pass it to Dana now to talk about our model if you haven't seen it before.
So this is the foundation of the course, really, and all the work that we do at the Childhood Trauma Learning Collaborative. And when you take the course, you'll see an earlier version of this model, but we wanted to share with the community of practice this really enhanced model that really centers youth within the places that we find them. We know that it's important to engage all of these environments together so we're all on the same page. That's the home environment, the community, the school, and other youth serving systems like the foster care system, the justice system. So all of these systems and environments, we want to be on the same page about these 4 sectors: prevention, reducing the causes of trauma. And we accomplish that by holding our systems accountable, for advocating for systems change, making sure that the resources that are done so equitably, educating the entire community about these things, and promoting holistic wellness. We also ask that all of our youth serving systems support youth in a way that identifies those in need, those mental health screenings that Martha mentioned. We want to connect them with resources, whether that's in the school building or the places that we're finding youth, or finding outside clinicians to meet those needs. Really important to deliver school-wide programming to help reduce help reduce the trauma that we know that all school children have experienced during the past 2 years with COVID-19. We also want to make sure that we're creating opportunities of growth and leadership for youth. We also want to make sure that we are developing protective factors. We know that having one caring adult in the life of a child who has experienced trauma can be transformational. So we want to foster those nurturing behaviors in the adults that interact with young people. We also want to take steps to build compassionate and equitable environments and cultivate that sense of community. While doing that, we'll be building resilience not only for the youth themselves, but for the staff that work with them. We know that when people experience trauma, they have a loss of agency. So we want to take steps to help increase that sense of agency for young people and the staff that work with them. We also want to increase the social emotional learning skill set. And a lot of that happens through that school-wide programming. And not last, but definitely not least, is to empower and lift the voices of students and their families. When we are creating these comprehensive mental health systems, if we're not consulting with the students and their families, we might not be creating the systems that they need and want, and they might not engage with them as effectively. So really important at the center of this work is bringing the students and families into this work as early as possible. So To help you do this, we've created this course, and we recognize that a 12-hour course can be extremely overwhelming. It's a lot of information. This course was designed out of the first 3 years of our Childhood Trauma Learning Collaborative, where we worked with a group of around 26 school administrators, district administrators, school mental health providers, and we listened to what their needs were in having more effective school mental health systems and services. And we brought in experts from around New England and the nation to provide professional development opportunities to meet those needs, and also to create reports, toolkits, guides, and lots of articles and blogs about these topics. So we've tried to take all of that information and condense it into the most important things schools need to know to cultivate school communities in this 12-hour course. And to help you all navigate the course and to disseminate it to other staff members in your school communities, we're designing an implementation guide. So we're going to be sharing that with you here in this community of practice. And we're going to be introducing it module by module, just sharing one guide each time we meet each month. So in our guideline today, we're going to go over the introduction of the implementation guide itself, which includes possible timelines for implementation and the features of each module's implementation guide. So I'd love to share it with you now, and you will get this via email after today's session. So you will get this, and we welcome you to engage with this as little or much as you like. The first section just tells you a little bit about this course and why we developed it for you all. We also give some recommendations for how different leaders, and you all are leaders, can use this with your staff in different ways, as well as how individuals can get the most out of this course. And then we provide a few different timelines. So as I mentioned, this is a 12-hour course, and different schools have different needs. So we've provided some sample timelines. You absolutely can modify these to fit your school's need, but we have a few guiding questions that can help you decide how to implement this course with others. We're recommending 3 different methods. You could either do this implementing the course in a single semester, either the fall or the spring. If you are doing it in the fall and winter semester, we've set out a timeline for you to start just before the school year starts in August, doing about 1 module every 2 weeks, wrapping up the course right before you break for that winter break, and then coming back after the winter break to start implementing that action guide, brainstorming your school community's vision and mission, and bringing the other members of the school community in for feedback, and then sharing that with your school community using that action plan that we will also give you. If that feels like too much time, doing too much in one semester, we've also provided a timeline where you're taking the course a little slower, having maybe once a month, having a module, and then kind of working on that action guide alongside the course, starting the action guide about halfway through the course. So similar steps, but a little bit different timing. And then we know that some schools prefer to do their professional development in an intensive summer session. So we've also set up a timeline where you can do this between June and August in an intensive summer professional development session. So when you get this implementation guide, just go ahead and review those pages and reflect on what might make the most sense for your school community. So another aspect of our introduction for the implementation guide is letting you know what's in this guide. So we have come up with these different supports that we feel will help you bring the practices and policies that we're recommending in the course into reality in your school communities. So one really important aspect is that the leaders who are facilitating this course for their staff, that before they introduce it to their staff, they do a little bit of pre-work. So this means that they're going to take each module themselves before they ask their staff to take them. And they might need to do a little bit of reflecting on where their school community is, as well as thinking about any professional development that has recently been done or any learning resources that have been introduced to staff that might complement the material in that module. We've also provided a little bit of extra explanation for complex topics that leaders might need to debrief with their staff about, especially around the neurobiology of trauma and the mental health screening. We know that a lot of that material is new to school staff. So we've provided a little extra context in the implementation guide for those complex topics. And we've also provided some sample discussion questions that you can use after staff complete each module to ensure that everybody is on the same page or to correct any misperceptions. There are many reflection questions embedded in each of the modules. And so we've just copied those into this implementation guide so that leaders have those at the ready and can use those in any debriefs and discussions as well. Another section of this implementation guide is some recommendations for implementation and policy change. We know that just watching some videos, reading some articles, or doing a few interactive activities might not get you all the way into how to implement these practices. So we've given a few tips for best practices for implementation and ideas for how to really bring that policy change into reality. And we've also linked to our action plan template, which you can modify. It's a Word document. You can download that from the Google Docs link and modify that as needed to meet your school's needs. We also recognize the importance of coaching. Research has shown that coaching can help new teachers gain the same level of skill and confidence as 10 years of teaching. So we really want to provide opportunities for leaders to coach their staff members on these practices. So we have linked here some feedback suggestions that you can use when you are coaching. And then in each module's implementation guide, we offer some specific ideas for how to do coaching and evaluation of these practices, this implementation of these practices. Finally, each module has a resource section. We provide lots of resources within the course itself, and just for your convenience, we have linked to any resources that are provided in each module in the implementation guide. I'm just going to pause for a second to check the chat. Yes, Ingrid has sent a link in the chat for the action guide if you want a preview of that, as well as the implementation guide, but you'll get those in a follow-up email as well. So then today we're going to go through our first module's implementation guide with you. But before we do that, I'm going to pop back over to our slideshow and pause for just a moment. Can you all see that slideshow? Yes, there we go. I'm going to pause for just a moment and ask a couple of questions. We talked about a few different timelines, and I'm curious, just thinking right now, you don't have to hold your staff or yourself to this, but thinking about your school's need, what makes the most sense to you? Would you do that over a school year, maybe having one module a month? Would you implement it in a single semester, doing about 2 modules each month? Or a summer professional development intensive, doing the whole course in a couple of months? There should be a poll up there. You can select a couple of questions and then you can check any of those elements of the implementation guide you think will be most useful. Great. Well, honestly, this is kind of the best scenario here. We've got one of each type, which is really wonderful in my opinion, because I love to hear feedback as you all think more in depth about how you're going to be implementing this. And it looks like a lot of you think most of these elements will be helpful. So that's great. Does anybody want to come off of mute and have any feedback at this point? We'll have more time for discussion in just a moment, but if anyone would like to share any initial thoughts or questions at this point.
I just want to welcome Jacqueline, who just joined us in the middle of reviewing the implementation guide. So welcome, Jacqueline. I don't know if you want to introduce yourself and let us know what your role is and where you're from. No pressure. But feel free to unmute yourself if you'd like to introduce yourself. Technology issues. We are very familiar with that, all of us. So we're glad you're here.
I think David had a question.
Kind of a response to the first question, but on the timeline. What I found with our school system, and again, I'm an outsider, I'm a retired LCSW, I do some work there and they're very welcoming. We tried to do a presentation on ACEs, and what I found was that they have so many things that they have to do in PD that they don't have time for what I would consider the important stuff. And so I would see a summer implementation, but I would also see that there would be a need for some kind of incentive to get people there. What the incentive would be, I don't know, funding or superb meal or something. But I think the summer program would bring together the most interested people and the ones most apt to really spread the word.
Mm-hmm.
And I think in our particular district, it would take a while to get that word spread throughout the system.
Mm-hmm.
That's my 2 cents, or a cent and a half worth anyway.
Yeah, that's a great point. We hope that the 12 hours of CEU credits will be an incentive for professionals who need those. But yeah, food is always helpful to bring teachers into any kind of community. Very good community builder.
We found that.
Does anyone else have any feedback? Oh, go ahead.
I was just going to say about the summer implementation. We also have found that, of course, people are overwhelmed. They're just overwhelmed with the amount of information, and sometimes thinking about doing this type of course, it can be energizing, right? Because it gives you new ideas and sort of, but it, you know, there are definitely teachers, educators, people on the front lines are really burned out too. So we understand that summer might be a time when people can focus more on these types of professional development opportunities. So yeah, I mean, in terms of an incentive, I think paying attention to those kinds of rhythms and how the staff is doing is a good place to start.
Anyone else want to share? Okay, we'll keep going. There'll be more time for discussion in just a second. So let's take a look at Module 1's implementation guide, and it's kind of perfect that you all are looking at this before we go into the course itself, because that's kind of the idea. We would like you to look at these implementation guides before you start the course. So in each of the implementation modules guidance, we start with just a brief 1-paragraph summary of what you will learn in that module. This first one is really just introducing you to the course itself, to the topics, and to how you will be learning. So this is a much shorter module compared to other modules. So we note that. And just so you all are aware, the second module is a little bit longer because this one is a little bit shorter, something to just keep in mind. So for Module 1, our pre-work is just to ask you to explain to your staff why you are asking them to take this course, really relating it to your school's needs. And then in each of these implementation modules, one of the pre-work assignments for the leaders will be to make sure to review the learning objectives of that module so that you are aware of that and so that you're aware of what you're asking your staff to learn as well. And to connect that to the strengths and growth areas for your school community. Then there's the debriefing and discussion. So for this first module, we think it's important that all of the staff have a firm understanding of which topics they are going to learn during the course. And then one point of confusion is the language between trauma-informed, trauma-conscious, trauma-responsive, and trauma-skilled. And so we provided some definitions here. These words are often used interchangeably. They mean slightly different things. And so having a better understanding of what these things means can be powerful in moving this work forward. And then it's important at the start of implementation of this course that you really have a firm understanding of the logistics and you communicate that with your staff. So you as a leader deciding what the timeline is going to be and then communicating that timeline with staff and having that paper calendar or digital calendar so that they can see all of the upcoming deadlines and due dates can be really helpful in getting folks to complete the course. And then there is signing up for the course. This is hosted on a platform called Healthy Knowledge. And at the end of our session today, if anyone has not created a Healthy Knowledge account and signed up for the course, we'll have an opportunity to do that. So please stick around after we close if you would like help signing up for that. We also give step-by-step instructions in the information session recording, which Ingrid put in the chat a little bit earlier. And then you'll need to decide how you are going to know that teachers have completed each module. At the end of each module, you are required to take a post-test and get an 80% to finish that module and move on to the next one. So one idea is to ask teachers to send a screenshot of their score or the thank you slide that appears at the end of each module, but you as a leader can decide how you're going to make that confirmation. For module 1, here are the reflection questions. Because this is an introductory module, we're really just trying to get a sense of what school staff understand about trauma and the prevalence of trauma in your school community, as well as what kind of mental health supports your school or district provides, and also giving you a chance to dream and vision what your ideal school mental health support system would be. For the implementation and policy change for module 1, we're going to introduce the staff to the action plan. And I'll make sure to put that page number in before we send this out this afternoon, and help them just review it and think about it. There's nothing to do with the action plan right away, but it's nice to have that from the beginning. And then you can talk with your staff about what social emotional learning programs your school or community already has in place. And we've provided some questions to facilitate that question. So for coaching, during module 1, if you are implementing a coaching component, this is where you would introduce that coaching procedure and schedule. So we've provided some tips for how to facilitate that conversation, including explaining why you'll be coaching, communicating the process and schedule, providing any documentation that teachers and staff might need. And then it's important that we as leaders don't create the goals for the program ourselves, but ask teachers what they would like to get out of coaching as well. And then finally, we have our resources from module 1. Moving forward, you'll see a lot more resources than this for each of our modules, but since this is just an introductory module, we've just got some links to the websites of the Mental Health Technology Transfer Center Network, our center, the New England MHTTC, as well as the Childhood Trauma Learning Collaborative webpage. And then you can see our references here. So that is our implementation guide. And I am once more going to stop sharing this. You can get that in the link that Ingrid shared. And I'm going to go back to our slideshow. And now, oh, sorry about that. We can have an open discussion about any reactions you have to that implementation guide. We are definitely looking for critical feedback as well. So if you see elements that are missing or confusing, that's really helpful for us to know as well.
One of the even, as I see it, one of the even pre steps is to sell it to the administration, isn't it? What wonderful hints do you have to do that? Again, I'm an outsider. I'm accepted at the school. I know the teachers. I know the administration. But again, a lot of what I hear is, well, we have so much that we have to do that we really don't have time to get this in. Where do we go from here?
That's such a good question, obviously with no easy answer, and your colleagues might have some thoughts, but what we have heard works for people is starting from a place of sort of curiosity and inquiry about what the needs are in the school in terms of mental health, wellness, talking to the administration about the some of the facts about trauma, the prevalence of trauma, the types of trauma, and also laying out really clearly what the effects of trauma are on schools and school communities directly. The loss of learning, students not being able to focus, them doing worse on tests, because we know they care about that, that it requires more funding and more staff to help address these needs over time. And that this one cost-effective, efficient, evidence-based way to approach some of these issues is to make sure that your community is more compassionate and educated about trauma and mental health issues. And we have a lot of resources to help build your case, because we find that that's often the case, is that there is some pushback on some aspects of mental health or SEL types of programming. And we can certainly talk about that in more depth to help you find that research. Another way that I really love is by telling stories of compassion, of students being connected within the community and how powerful those are, because, you know, we obviously make decisions about programming with our heads, but we are led by our hearts. And so that storytelling aspect and getting people's real on the ground perspectives about their need is really crucial.
Ours is a small community, and the communities to which we hope to outreach are small communities. Do you see that the impetus for such a thing would come from the administration, or is it more a question of educating the community, having them informally talk to school board members, to teachers, and sort of developing it on an informal basis rather than a, here is a ring binder with 53 pages and of which 47 are references?
Yes.
Yes.
Yes, co-creation within the community is a key aspect of this course, of all of our recommendations. And David, thank you so much for this recommendation. I've already in my head said, oh, we need to add a section here of how to sell this course because yes, there are talking points. Martha illuminated quite a few, and one that we've been having meetings with the state departments of education in New England, and over again, what we are hearing is that there are not enough school mental health professionals to meet the needs. And even outside of the school building, there are not enough clinicians to meet the children's mental health needs right now. So what this course does, it's not promising that we are turning teachers into school psychologists, not at all. we are helping educators understand how to use compassionate, trauma responsive practices so that they can build a school community that reduces trauma and addresses it effectively. So this is really a way to fill those gaps that we know nearly every single school has right now. And it's really more effective because we also know that while there's a dearth of people, there's open positions that are not being filled. When those positions fill, they are often not filled for a long time. It's hard to retain that staff. So when you are teaching these practices to educators that are going to be in that school building for a decade or more, that's a much more effective way of ensuring that these evidence-based practices really get implemented.
Thanks.
Yeah.
Also think that having the call come from the community is really important too. So talking to parents about mental health issues, particularly if you're in a small rural community, that's the kind of community that I come from. And so talking to parents and having parents talk about what they're seeing in their children at home and what teachers are seeing in their classroom in terms of students being distressed, students acting out. So starting to use the people in your community to press the need upon some of the school officials. It can be really helpful. But we're really glad you brought that up. We absolutely need to add that. Dana, is there something you want?
Farrell, go ahead.
Yeah, well, and also I think for me, what I'm envisioning, I'm not sure if this will work in other settings, but I just thought, myself first, and then start with a small group. Like in my case, I was start with the school social workers. Mm-hmm. And then let them be the messengers, if you will, because in some spaces we have a lot of influence. And so I guess I see it more, even though I'm very much challenged in an educational setting as a social worker, not so much a top-down approach, but I guess bottom up, as people would say, and how do we impact the system. And so I feel like starting with a small group of social workers, and they go out and, and champion, to the individual schools, particularly because they have relationships with that staff. That's what I envision. I know it won't be 100% necessarily all the social workers, but many of them will be willing to do that. But also my question, I just wondered before doing, and it may be here, so again, I apologize, I'm not as familiar with the curriculum, but sometimes I wonder, instead of saying, hey, how about a 12-week course? I was just wondering, is there something that gives an overall, like if we want to do a professional development or something for an hour, just give a whole overview, and get a flavor for what's involved, hear some stories, do some work along that, and then and from there to say, okay, if you would like to participate, but just again, just something, just to, if you will, whet one's appetite.
Mm-hmm. Yeah. So for the course itself, we have a 25-minute information session, which Ingrid linked in the chat, and we should add to the implementation guide. And that can be to sell the administration or the staff, perhaps, on the course itself. But in terms of like an overview of everything we're talking about, some of the resources within the course are clips from 1-hour professional development trainings that we've done with our audience. And we have listings of all of those different trainings by topic. So perhaps another thing that we might want to add is a few links to some of the longer full length trainings that we have that could be, pre-work before the course. That might be something that would be interesting. Great question, Bessel. Sorry, Beryl. We only have a few minutes left, so I did want to really briefly, before passing it back to Martha to talk about our collective goals here, just show you the first module of the course. And again, we can help you to, oh, sorry, one second. We can help you to, can you see the course there? Yes. We can help you to sign up for it at the end if you stick around for a couple of minutes, but When you get to the course, you'll see this and you can use the next button to kind of navigate through. Again, each module is going to have this pre-test that you have to take before you're allowed to move forward. But in this first module, we just talk to you about the course topics, what kind of tools you'll be using, how to navigate healthy knowledge. And then we tell you a little bit about ourselves, the MHTTC network, our principles, and the work we did in the Childhood Trauma Learning Collaborative, which really informed this course. And then you have some reflection questions, and that's going to happen in each of the modules. You'll have reflection questions. And this first module that's really quick, you'll just take the post-test and that's it. So if you have a chance to take that module before the second meeting that we have together, that's great. If not, don't worry at all. And I am going to pass it back to Martha to talk about, let's see if I can find it there. Do you see my slideshow? Yes, okay. I'm gonna pass it to Martha to talk about the shared goals.
So I know that we don't have a lot of time left. I'm really grateful for some of the feedback you've already given about how you're thinking about using this course in your setting and how you're thinking about your own work in this area. In terms of our thinking about this community of practice, we want to, first of all, create an intentional community and connections for you all, for peer support and great ideas like Beryl's response to David's question. We want to provide answers to the questions that you have about the course and the material, to provide technical assistance in terms of implementing any of the practices within the course or within implementing, doing the course in a community as well, providing support to you as you're working in school mental health, and to also enhance the effectiveness of our implementation guides so that people using the course in years to come, that they will benefit from some of your feedback on it, so that we can improve it for future participants, which you've already started to do. We're very grateful for that. We don't have a lot of time to talk about your goals in this community of practice. So I think perhaps, given that you've already given us some feedback, unless somebody has something that is really a burning comment or question, we'll move on to the schedule. Okay, we will come back to that question about your goals for this community of practice, because that is a really essential part of what we want to do, is make sure that this community of practice is relevant and effective for you. In terms of our upcoming sessions, we have one a month. This is the schedule, which is also available on our website, and the materials that we'll send you. So don't worry if you can't write all of this down. It'll just be once a month. And of course, we're available at other points for questions or technical assistance. Any questions and answers at this point? Or any questions? Or maybe you have all the answers. That would be great. Okay.
Well, our next steps, if you are feeling ready, these are optional, but you can discuss the course with your staff if you're ready. Please do review the Module 1 implementation guide that you'll get, or that you got at the link there. If you're ready to implement Module 1 either as an individual or as a staff leader, you can feel free to do that in the next month, but don't feel like you need to. If you have the time to take Modules 2 and 3 as an individual, that's kind of what we are planning to go over in our next meeting together. And then we do ask you to register for each session of our community of practice separately. So please do register for the next session on December 9th. We're alternating between 10 a.m. and 3 p.m. because we know that different folks have different availability, but each of these sessions will be recorded and sent out. So if you aren't able to make the 3 p.m. hour, please still register and you will get a recording of that. We do have some C-TLC events coming up. December 1st at 3 p.m. we have a presentation with our colleagues at Harvard about early intervention for psychosis in young people, a lived experience and school perspective. We hope to see you at our next community of practice here for Cultivating Compassionate School Communities, December 9th. Also on December 9th, we have a 90-minute training session for schools and preventional professionals who are working together to create trauma responsive environments. And then starting in January, we have a HEART webinar series and community of practice. This is a group of people, healthcare workers and educators addressing and reducing trauma. This is about any schools working with healthcare centers or other community-based organizations to have inclusive school-based mental health systems. We'll be talking about effective practices for collaboration. We are funded by the Substance Abuse and Mental Health Services Administration, who asks us to evaluate our services. It really does help us improve our presentations and to secure these free opportunities for you all. It's only 3 short questions. So if you could grab your phone and scan that QR code or click the link in the follow-up email that you will get, that would really help us out. We also encourage you to sign up for our newsletter, which you'll get a link to there. We're also on social media there, and you'll be invited to join our Basecamp platform where we share resources and other opportunities for webinars and presentations like this. If you have any questions about a certificate of attendance, you can email us at newengland@mhttcnetwork.org. Please do check out the New England MHTTC's website there. And if you have any questions for us, our email addresses are right there. And we really, really thank you for being here. And if there are any other questions, you can pop those in the chat or email them to us. But if anyone would like to stick around and get some guidance on how to sign up for the Healthy Knowledge course, you are welcome to stick around. Otherwise, thank you so much for being here.
Thank you, and we hope to see you again.